Welcome back, everyone. For this lecture series, we're going to take a look at the head, eyes, ears, nose, and throat. We're going to start looking at this module with a brief anatomy overview. HEENT is a common abbreviation that we use to describe the grouping of diseases that affect the head, the eyes, the ears, the nose, and the throat. It may also be called EEENT. A significant number of calls to service or encounters that you're going to have as an EMS provider with HEENT diseases will be predominantly trauma related. You may have some infection related, and a lot of times these patients, while they may not need emergent care, they may need access to a specialist, particularly an eyes and ears, nose, and throat specialist for definitive treatment or treatment of an underlying trauma that has occurred. So looking at the anatomy of the eyes, you've got a couple of nerves that you need to be aware of. You've got the optic nerve, which moves directly into the back of the eyeball. And then you have the oculomotor nerve. These are going to be the third and second cranial nerve, respectively. The oculomotor nerve helps control the eye motion of the eyeballs and upper eyelid, while the optic nerve provides the sense of vision to the optic chiasma and optic cortex of the brain for interpretation of those visual images. Looking at the eyeball itself, you've got the iris, which is the colored portion of the eye. The cornea overlays the front lens of the eyeball and the iris and somewhat protects the eye. You've got suspensory ligaments that help adjust the pupils as well as the ciliary muscle. And then you have the anterior chamber of the eye, which contains all of those pieces, and it's filled with aqueous humor. The posterior compartment is filled with a substance called vitreous humor. Inside the globe of the eye itself, you can see the terminus of the arteries and veins as well as the optic nerve. And then the fovea, which is a concentration of visual receptors that you can see in the back of the eyeball itself. Looking at the external area of the eye and the face, you've got the sclera, which is the white of the eye. The lacrimal glands, which are superior and lateral to the eyeball itself. And so when you tear or when your eyes water and lubricate the eye, it's actually coming from the upper portion of the eyeball, draining across with gravity toward the medial inferior portion of the eye where it drains through the nasolacrimal duct. The redness under the eye, so if you pull the eyelid back, you can see the capillary membrane there. That's called the conjunctiva. And that's a great place to be able to actually assess peripheral perfusion. So in patients who are hypoperfusive or in states of shock, you'll see the blanching of that conjunctiva, and it will look whitish in color instead of red. Looking at the cranial nerves, these are the 12 pairs of nerves that innervate the face and neck muscles that come directly from the brain. Interesting thing with the cranial nerves is they never enter into the spinal cord. So they're the few nerves that don't enter into the spinal column and then branch out. They come directly from the brain and then innervate various muscles within the face and the neck itself. You've got the olfactory nerve, which is number 1. The optic is 2. Ocular motor, which is 3. Then you've got trochlear, abducens, vestibular, cochlear, hypoglossal, accessory, vagus, glossopharyngeal, facial, trigeminal, all in pairs. So you've got one in the left and one in the right, respectively. The nose is an important sensory organ for the body. It also serves as a purpose, and we talked about this in airway, that's to filter and warm air coming into the nose. You can have some smelling disorders. So anosmia, that's a tough word to say there, is a total loss of the sense of smell. Dysosmia is distorted. Hyperosmia is increased sensitivity. Hypo prefix being low sense of smell. And then presbyosmia, which is a loss of smell from normal aging. One of the 2 entry points for oxygen, it also warms and humidifies the air as it enters the body, as we've discussed before. Other structures, the sinuses that are in the front of the face can be a cause of concern, inflammation, irritation, and ultimately a response from EMS. You can see there that you've got the ethmoid sinuses around the edge of the eye, the sphenoid sinuses, which are deep behind the nares, maxillary sinuses, which are just inferior to the eye, and then the frontal sinuses, which are above near the eyebrows. When you're assessing the mouth, the assessment begins with opening the mouth and having a look. We do that for airway, but you also want to take a look at the teeth, the oral structures in the mouth, and the teeth, the health of the teeth overall. And we won't go down into specific anatomy of the tooth itself, but you've got the enamel, which is the outer layer, the dentin, and then that moves into a root, and that's rooted into the gums themselves. With the mouth, you've got several of the cranial nerves which help control the mouth and structures of the face. You've got hypoglossal, glossopharyngeal, trigeminal, and facial. You can see there that you've got the sublingual glands, which are just below the tongue on either side of the mouth. We use that area for administering sublingual medications as well. So if you are administering things like nitroglycerin, you're putting that under the tongue. You've got the masseter muscle, which is the primary muscle of chewing, and then a couple of other ducts and glands that are in the mouth there. Looking at the neck, here's the anterior portion of the neck. You can see that down the midline, just above the trachea, is the thyroid cartilage. It's surrounded by muscular tissue and really hard to identify, but you can palpate that on the mid portion of the throat for your patients. You've got the carotid arteries, which run up each side of the neck, that are sort of protected behind the muscles there, particularly the SCM or sternocleidomastoid muscle, which runs from the center of the chest up to the sides of the head. Major blood vessels that are present, you've got internal and external carotid arteries, and then the internal and external jugular veins that are both present in the neck, which you can see a little bit better on this image here. You can kind of see the division of the veins and arteries there and how they move about the face and neck.